I was presented with a patient who had IT band pain and TFL pain, as well as a 3-week-old hamstring strain. In order to address the pain of the IT band and TFL, I wanted to strengthen the underactive AD ductors as well as the overactive AB ductors. In order to address the hamstring strain, my strategy was to increase the hamstring strength as well as its ability to handle load. My first exercise would be the AD ductor plank. This is to engage those AD ductors as well as strengthen them in order to take some of the stress and load off those AB ductors, the TFL, and that tight IT band. Here we have an adductor plank, so this is going to be a great exercise for really engaging and strengthening the AD ductors. Strong and engaged AD ductors can help take the load off the TFL and IT band. Cues to remember would be driving that knee into the chair. This will really engage the AD ductors. You also want to squeeze the obliques that are closer to the ground or on the contralateral side and really expand and lengthen the ipsilateral side, or the same side is working. Last, you want the athlete to pull the other leg toward the midline away from the ground. This would be the regression variation of the AD ductor plank. Because the foot is on the ground and not elevated, there's less load on the AD ductors. This does, however, come with a very important cue, which would be to be firing the quads the entire time. That way you keep the knee fully extended. This keeps the knee in the closed pack position, taking some of the load off of those ligamentous structures. Additionally, you want to keep some of the same cues from the previous adductor plank, keeping the same side obliques lengthened and keeping the contralateral side contracted, as well as keeping the opposite leg pulling towards the midline away from the ground. With this variation, the force is driven through the ground with the inside of the foot rather than the knee. A variation for progression in the adductor plank would be with the knee again fully extended. This combines both versions of the adductor plank. Again, the knee needs to be fully extended, that way it's in a closed pack position, taking stress off the ligamentous structures, as well as the same cues, opening up the ipsilateral side and contracting on the contralateral obliques, as well as driving that inner foot into the chair this time. In terms of setting reps, it should be set on a case-by-case basis, varied by the individual's needs. We would continue strengthening exercises with the hamstring curl next. So here we have the hamstring curl. It's one of the most basic exercises for strengthening the hamstrings. You can do it with a skateboard like I'm doing, you can do it with gliders, or you can even do it with socks on hardwood flooring. Some cues that you want your athlete to remember is maintaining a posterior pelvic tilt. This allows the hamstrings to be in a more neutral state rather than being lengthened and not allowing for an effective contraction. It also allows the abs to be engaged. Along with that, you want them to keep their ribs down. Pulling their ribs down with their abs also helps to maintain that posterior pelvic tilt, keeping the abs engaged. You also want them protracting their scapula along that rib cage, so reaching towards the ceiling. Along with that, you want them to drive their heels into the ground, lifting their hips up off the ground. From there, they'll pull their heels in towards their butt. You also want to remind them to control the eccentric contraction, so controlling the movement of their heels away from their body. A regression of the hamstring curl would be a hamstring bridge iso hold. So here, if a dynamic movement is too difficult for them and their form begins to break down, you would prescribe this isokinetic hold in order to increase their strength. Some of the cues that you want to remind them are going to be similar: posterior pelvic tilt, ribs down, protracting the scapulas, and just keeping that real good hamstring contraction. Now the progression past a regular hamstring curl would be a single leg hamstring curl, where they're just doing one leg at a time. The cues here are going to remain extremely similar: ribs down, posterior pelvic tilt, but instead they're driving all their weight through that one heel, pulling that single heel in towards their body while keeping that contralateral leg raised. In terms of setting reps, it should be set on a case-by-case basis, varied by the individual needs of the patient. We would continue strengthening the hamstring with the staggered stance RDL. This not only addresses the hamstring strain that the patient had, but also strengthens the musculature around the TFL in order to support that issue. We have a staggered stance RDL, or Romanian deadlift, as an exercise to strengthen the hamstrings. Before talking about the staggered stance RDL though, we must acknowledge the hinge. So in the hinge motion, it begins at the hips, bending at the hips, driving the hips backwards while also letting the torso fall forwards. This creates a nice counterbalance effect, allowing the center of gravity to stay over the base of support. As you can see, the tibias are still perpendicular with the ground. While allowing the weight to drop straight down towards the ground, you're also maintaining a posterior pelvic tilt with your ribs down. Both of those movements together combine to engage the core. This also allows the lumbar and thoracic spine to remain neutral in alignment. As you can see here, I pointed out that my cervical spine or my neck is in extension, which shouldn't happen. I should keep that all in line. So with the hinge pattern in mind, let's take a look at the staggered stance RDL. So with one foot slightly behind the other, you're going to put all your weight on that front foot, and that'll be the working leg. This allows isolation of that one side hamstring while still allowing the patient to balance himself. As you can see here on the working side, the hips fall backwards as the torso moves forwards. Again, that hinge pattern with the posterior pelvic tilt and the ribs down for the ab engagement. Almost no weight should be on that back leg, it's only there for support and balance. The regression for the staggered stance RDL would be the standard RDL. So here both feet are in line and shoulder width apart. You're hinging at the hips again with equal distribution of force through both feet. A progression to the staggered stance RDL would be the single leg RDL. Here, absolutely no weight is on the back foot or the non-working foot. As you can see, it's in the air. The hinge is still happening at the hips as the hips drive backwards. The torso falls forward, and you still have that ribs down, posterior pelvic tilt to keep the spine neutral. This is going to be more difficult for the athlete as he has to focus on balance and keeping his core even more tight and using those hamstrings even more. In terms of setting reps, it should be set on a case-by-case basis, varied by the individual needs of the patient. The next exercise would be the frog bridge. This addresses the TFL directly. Building strength there could alleviate some of the pain. Here we have a variation of a glute bridge called the frog bridge. This is intended to target the TFL and the abductors and increase strength and neuromuscular coordination. It is very similar to the regular glute bridge, but here the bottom of the feet are together, the knees are apart, and the hips are externally rotated. Here force is driven through the outsides of the feet to lift the hips up and contract and strengthen that musculature. The regression of that exercise would be the frog bridge iso hold. Here you're just holding in order to increase strength as well as fire those muscles correctly and increase neuromuscular coordination. The progression to the frog bridge would be this variation with the upper body elevated. This puts more load on those hips, leading to increases in strength. The cues remain the same, driving through the outsides of the feet and lifting the hips up off the ground towards the ceiling. In terms of setting reps, it should be set on a case-by-case basis, varied by the individual needs of the patient. The next exercise would be the adductor high plank. Here we are not only strengthening the adductor concentrically, but we're also allowing it to absorb load, an important skill in sport performance as it helps with decelerating and changing directions. Here we have the abductor high plank. Here by swaying side to side, you are not only working on strengthening the abductors in a concentric motion, you're also working on slowing down that movement as you're heading towards that side. So you're also working that eccentric contraction, which is super important in terms of sport performance and injury prevention. Here the cues are very similar to a regular plank, engaging that core by keeping the ribs down and posteriorly tilting the pelvis, and you're also swaying from side to side, so you're always controlling that eccentric motion, making sure you're not just dropping down. You always have control of the movement. The regression to the abductor high plank would be an abductor low plank. Here you are on your elbows, so you're decreasing that range of motion from side to side. Again, the cues are the same, so you're posteriorly tilting that pelvis as well as keeping the ribs down to engage that core. A progression to this exercise would be the abductor side plank. So you are in a side plank position, bringing your hips up by using those abductors. So here the cues are very simple. You're driving through the outsides of your feet to lift the pelvis up. It's a straight up and down motion instead of a rotational motion. So you bring the hips straight up. In terms of setting reps, it should be set on a case-by-case basis, varied by the individual needs of the patient. The last exercise would be the split squat step up. This is an explosive movement, which is super important in sport performance, as well as an eccentric loading of the hamstring, absorbing force, again, super important in terms of returning to sport. So here we have the split squat step up, which is a great sport specific exercise in terms of eccentrically absorbing load as well as creating power. However, you can't talk about the step up until you talk about the split squat, which is a great exercise in general. So here you want to keep the ribs down with a posterior pelvic tilt. You want to have the weight of the body dropping straight down in the middle of the base of support. That way you have that right angle between the tibia and the femur and have scapular protraction. So here you can see I keep those same cues while also exploding up. That way I get enough elevation and I drive my knee up in hip flexion. That way I can get my foot up to the bench. While great for building strength and power, you're also practicing absorbing force. The regression to that exercise would be the standard split squat. Here, as you can see, following all those cues, the progression to that would be a rear foot elevated split squat step up. So here, again, you are exploding, but you have your rear foot elevated. So same cues apply, but you're also forced to explode higher and generate more force. Because these are explosive movements, not as many reps will be prescribed. In terms of setting reps, it should be set on a case-by-case basis, varied by the individual needs of the patient. So through these exercises, we are building neuromuscular coordination, engaging those adductors to take load off of the TFL and IT band to alleviate that pain. We're also strengthening the surrounding musculature in order to return the athlete to sport as well as alleviate some of that TFL pain. We are also focusing on return to sport needs through functional sport-specific movements.